There's a lot of evidence-based tools and techniques in this programme, and they're used really to help bring the very best approaches from the world of management science and leadership science, innovation and social movements, all into one place. Not to be a framework or a script, but rather a set of tools that people can draw on.
By using the tools and techniques, it brings a sense of order into the room. Although what you produce may not be very tidy at the beginning, there is a sense of a group working together and working as a small team.
The driver diagram approach, in terms of a really simple way of describing what you're trying to achieve, has been really powerful.
Driver diagrams are also very, very good at actually looking at the root causes of particular issues and coming to solutions very, very quickly.
So it helped us really to turn our data that we collect, traditionally feeding the beast, into data that supports service improvement.
The NHS change model that's particularly helpful when you're working across boundaries, when it's more than just a project you're working on, it's a programme or even something bigger than that.
It's a really simple model. It's got 8 components, but it's been built from about 20 years of work in this field. It's just a very good framework for saying, are we paying attention to all these different elements?
I think it was really good to map ourselves against those components and understand where we were in our journey and where our strengths and weaknesses are.
I think the middle part of it basically says start somewhere, attract some supporters, go through an initial cycle of change and keep on refreshing that, keep on building the energy. And I think those two frames really resonate to the world of CCGs and their partners.
The feedback that I've got from practices is they really liked the S-Bar, and they've used that in quite a few different scenarios. They've used it for referral letters, they've used it for taking minutes of meetings, various places where they've used that structure.
It's wonderful seeing people who take that tool, they practice it for the first time, and they come back saying, we had that public meeting, or we had that really challenging meeting amongst the local commissioners or with that provider, and I told my public narrative at the beginning to explain why we're doing this, and I've never seen a meeting go so well. We've got movement on some big issues for the first time.
We've used the story of one, the story of self, in a number of different ways to actually talk about what we're trying to do in a very much more personal way, and being able to actually say, actually we're here to make it better for patients, and we are patients or could be patients, and therefore this is why it's important.
My impression is that quite a few of the programmes have particular local needs, particular visions that they want to address, and the team has worked with people to say, if that's where you are, here are the techniques that would suit you.
It's been a journey for us, and I think that people, as they've gone along, have really enjoyed getting into using things that would never in their day-to-day practice come into contact with. So overwhelmingly positive.